Okay, folks, good afternoon. Happy St. Patrick's Day. My name is Ian McCrory. I'm a Senior Improvement Advisor in the Career Inspectorate. And I want to applaud whoever has put on the Q&A function there around the two cats story. Excellent. Also to applaud everybody else on the call who hasn't put anything in the chat function around their best St. Patrick's Day story, because we all know whatever happens on St. Patrick's Day stays on St. Patrick's Day. This is the penultimate series or element of our series of winter webinars. Some of you will have been to some of the ones we've delivered so far. Next slide, please. And we're going to follow the same format around that. So today's around the essentials of safe care. The essentials of safe care have been co-produced with various stakeholders within health and social care in Scotland, and we've invited our colleagues from Healthcare Improvement Scotland and other colleagues from services across Scotland to introduce that to use today and talk you through what that package of tools and resources will look like, and further to that, how it will be supported with its implementation. But before we hear from our speakers today, it's to remind you about the functionality of Microsoft Teams Live, which is quite different to Teams calls normally, where you can't interact with us by using your cameras or speaking, but you can type questions into the Q&A function, which again is the speech bubble with a question mark in it. And we'll pose some questions to you quite early on as we move through the slides for you to consider, but also please do ask any questions that you want to hear from our speakers today in the Q&A function, and we'll take some pauses to do that. Next slide, please. Very briefly, my role is to introduce this package today as I have the lead for delivering the winter webinars, and our objectives today are quite succinct. We want to provide an overview of the package of guidance and support that is the essentials. We want to explore how they can be used within your service and not only with your service members of staff, but also people who experience care. We want to hear from people who have tested this approach out within their service, which will be part of our speakers today. Also to set the scene about how the system of support, implementation and learning can be taken forward as the essentials move forward throughout the course of the year. So it leaves me to introduce Joanne Matthews from Healthcare Improvement Scotland iHub, who will start to take you through the elements of the package. Thank you.
Thank you very much. Next slide, please. So good afternoon, everybody. Hello. And firstly, a huge thank you to the Care Inspectorate for this opportunity to share with you today what in effect has been a truly whole system team effort over the last 9 months, bringing together people from across health, social care, the third and independent sector and housing to design and develop the essentials of safe care. For those of you who joined the winter webinar series calls prior to Christmas, you would have heard me trail this work, and for those who were not able to join, my name is Joanne Matthews, but everybody calls me Jo. I work in the Healthcare Improvement Scotland as the Head of Improvement Support and Safety, which includes the Scottish Patient Safety Programme, SPSP. Last week, SPSP published the Essentials of Safe Care, an evidence-based package of guidance and support which aims to enable the safe delivery of care for every person within every setting, every time. This session today marks an important step in that next phase of the work, in which we share the package and ask for your continued help in achieving this aim. Next slide, please. As Aidan has just described, over the next 90 minutes, we're going to tell you the story of the Essentials of Safe Care, provide an overview of what it is, consider the benefits for all perspectives, from the organisational perspective, staff and service users, but not at that theoretical level, but from an organisation and people actually delivering the services within social care right now. You'll hear how this connects with and enhances existing work that many of you are already undertaking just now, and describes the systems for learning and improvement that will be available. We're keen to answer any questions you may have, so there's a couple of Q&A slots that are included, and Aidan's just highlighted the chat box to you. Please don't be shy, get those questions in. There's no such thing as a daft question, and as we've tried to set out from day one, this is about sharing and learning together, so we're keen to have your questions. Next slide, please. You'll be delighted to know that you're not going to be listening to me for the full 90 minutes. I am so pleased to share with you our brilliant speakers for today and send my thanks to all of them, and not only supporting the work of the Essentials, but a massive thank you for your time today. Next slide, please. So SPSP is a national quality improvement programme that aims to improve the safety and reliability of care and reduce harm. It's been in existence for roughly about 13 years now. And some of you may know us from previous collaborations that we've undertaken with the Care Inspectorate and Scottish Care to reduce pressure ulcers in care homes. We have a website and a significant social media presence through Twitter for those of you who tweet. So the information is going to be posted into the Q&A so that you can actually find the links to our web pages, and also if you want to follow the hashtags for further information. This time last year, as we entered our first lockdown, the SPSP programme was placed into what we called hibernation, and much of the team were redeployed to support the rollout of NHS Near Me. During the summer, the programme embarked on a significant stakeholder engagement piece to understand from services and systems across health and social care what had helped them during the first wave of the pandemic and what would help them beyond COVID. And from that, how best could a national safety programme support them? Consistently, there was 3 key themes that came through to us. The essentials of safe care, which we're going to describe in greater detail. Some specific areas of improvement for existing programmes that SPSP supports, such as falls, stillbirth and least restrictive practice, but in a focused and much smaller way. And lastly, really developing those learning systems to support and facilitate the acceleration of change and improvement. In essence, creating those conditions. Next slide, please. There is no doubt the COVID pandemic has presented significant challenges for health and social care systems. Safety is the guiding principle in all of our work. So as we now plan for the new context we are working within, creating the conditions for maintaining safety for those receiving and delivering care is both a strategic and operational priority. And let's be honest, a fundamental right for every person. In developing the essentials of safe care, we have brought about a system-wide approach to creating the conditions, with at its heart a health and social care network coming together around the shared goal of improving the safety of care for all. Next slide, please. So as you listen to this session today, I would ask that you consider, how can the essentials of safe care support you in your work? Next slide, please. When you think about our pre-COVID world, the top line, were our daily essentials: a phone, a wallet, keys. It's fair to say that our world has significantly changed, and these items along the bottom row now form today's essentials. We don't leave home without them. So thinking from a service perspective, understanding and ensuring that you have the essentials for safe care in place and they're reliably implemented for every person within every system, every time, is fundamentally important to how services are planned and delivered. Next slide, please. There are 2 key documents that have flagged both the work itself and the approach in which we take with colleagues across Scotland to design, develop and now support that implementation around the package. As we started to develop the concepts last year, the Scottish Government recognised the importance of the work and demonstrated their commitment to ensuring the essentials were in place within the Programme for Government published in September 2020. This really reinforced the messages that SPSP had heard from stakeholders and that we were on the right track. And as we began to understand the variation in the reliability of implementation of the essentials across health and care, it will come as no surprise that as an improvement team, our method would be to apply quality improvement approaches to develop the content, iteratively test it, measure and revise what was in it to enable us to get to where we are today. The benefits of this approach and how it's been applied through SPSP was most recently called out in the published independent review of adult social care and will continue to be our method going forward. Next slide, please. So what actually is the Essentials package and how was it developed? The package itself aims to provide evidence-based guidance for the safe delivery of care in all settings. It brings together existing guidance and standards into one overall package, which includes a driver diagram, information about what are the changes that you could undertake to make improvements, and alongside that a measurement framework to help you understand if you are making improvements, all of which can be applied in any health or care setting. 4 design groups were formed with representation from services across health and social care. All the groups developed the package underpinned by some key principles. A human rights-based approach, not mandatory, and reflected existing knowledge and guidance that was in place. They have been developed in such a way that they're sufficiently generic and can be adapted to reflect any setting. And they also align to the ask of services just now, for example, the Care Home Huddle tool and the resources that are identified within the Care Inspectorate Compendium. Testing the application of these essentials was completed in January 2020, with services across primary care, community, acute, mental health, care homes and care at home services all participating. And after a huge amount of hard work, the package was published last week. And none of this would have happened without the help of these people throughout the journey. Next slide, please. Next slide. And through those design teams take a quality improvement approach. This is the driver diagram. In effect, a route map to enabling the safe delivery of care for every person within every system, every time that has been developed. The 4 primary drivers reflect the 4 priorities the design groups identified, with the secondary drivers describing the key elements for each. What rests behind each of the secondaries is the rationale for why these are important, what's already expected within existing guidance and standards, and a range of resources and tools for people to access. Next slide, please. To ensure that the package remained true to those principles set out at the beginning, and to inform how we developed the platform people could access, the resources from the draft needed to be tested with a range of services. These included GP practices, community teams such as community respiratory teams, social care, that included care homes and care at home services, inpatient mental health and the ambulance service. The teams were asked to look at some key areas, including language, applicability, ability to implement the essentials within individual contexts, and how accessible was the actual resources. And feedback was sought through a combination of online questionnaires, semi-structured interviews with those undertaking the testing, and then bringing everybody together in a focus group to share their experiences and reflections. Next slide, please. What has been published has informed by the feedback we received during that testing. And we recognise that we cannot solve everything straight away. We'll need to continue to get the feedback to develop it further and continually adapt to what you need. So we ask that you take a look, have a go, tell us what you're thinking so that we can keep improving. You can here see some of the recommendations and the feedback that we received. And as you go through the Essentials of Safe Care package, I hope you will be able to see how we've been able to reflect that feedback and that learning within the final package. Next slide, please. And that final package was, as I said, was published last week. And our website went live with an interactive driver diagram that contains a library of resources to support implementation. A measurement framework for local use is being developed with 2 sections in it. The first is a readiness section that will help your organisation and your teams understand how ready you are for change, coupled with a tool to understand how you're doing against each of the essentials. For that assessment, services can prioritise their areas for improvement and you use the second part of the measurement framework to support them in their improvement work. We're not expecting services to submit data, and this would not be a mandatory requirement. However, we would be keen to hear from people to share their measurement as part of telling their stories within the wider Essentials of Safe Care network. Underpinning all of that will be the learning system, which will include the network, and my colleague Jill is going to speak more about that later. Our ability to achieve the overall aim of safe care for every person within every setting, every time, will very much be determined by how organisations and teams use the package within their context, translating it into reality, making it real. The next part of our session today is going to help with bringing the package to life. Over the next 20 minutes, you're going to hear from organisations who kindly supported us in the testing phase and are here today to share their reflections on what this means for their organisations. So I'm delighted to hand over to Nick Price, Managing Director and owner of MyCare. Over to you, Nick.
First slide, please. Thanks, Jo, and thank you very much for the opportunity to be part of this piece of work. Next slide, please. My name's Nick Price. I'm Managing Director of MyCare Grampian and Tayside. We're a care at home and housing service, housing support service up in the northeast of Scotland. Next slide, please. So typically, I was a wee bit late to the party with this. I only became aware of the essentials during the Care Inspectorate webinar, I think in late December last year. Straight after I contacted Jo, as I was really keen to find out more and to be involved, because I recognised, possibly selfishly, but how this could benefit the service. Slight health warning, really. It's still early days for us. We've only really dipped our toes in through a tabletop reflective exercise. And to be honest, we didn't initially appreciate the scope and breadth of the essentials. My initial focus was on our quality assurance framework. This was being reviewed at the time as part of another piece of work, but also we were trying to ensure that the Care Inspectorate Key Question 7 was sufficiently incorporated into our framework. And we were also doing a piece of work reviewing our staff support and development for some newer members of the team. We already had in place our own orientation and development plans to support staff, but it became clear quite quickly that the essentials would tie very well into this and complement what we already have. I mean, bearing in mind that we were and still are in the middle of a pandemic, and we were trying to find time to review our QA framework, as already stated, it became apparent that this was a great opportunity to consider how else it could be applied to the service as a whole. So really it was time for a bit of reflection and consideration. Next slide, please. So it became apparent the added value essentials could bring to the service, and that we also needed to further our knowledge. We needed to consider its application to our service, and it called for some wider thinking and planning. I completed the critical friend testing for the essentials, and the brief findings were that as a service we were considering and addressing almost all elements. Some areas we were more robust than others. Some of our evidence and measurement was good, but in some areas we weren't measuring ourselves across all aspects or sufficiently evidencing what we were doing. Our ability to provide robust evidence could potentially leave us exposed, and as a provider, I guess you would expect it took my thought processes back to our continual improvement ethos, but also linking it back to Care Inspectorate inspections. So we looked at what we already have in place, which was a reasonably comprehensive quality assurance framework and quality management system linked to our continual improvement system, but has room for improvement. You know, if you have that critical view and you're prepared to be honest, you probably find that everything always does. We have embedded systems and processes in place to operate the service, which are linked to evidence and research-based principles. But of course, ensuring that these are always up to date is time consuming. We have good staff supports and learning and development in place, and we've got as I said previously, a continual improvement ethos embedded, looking to see how we can improve our standard of service delivery. And we've got reasonably good recording and evidence logging in place. So I have to say a pretty comprehensive critical consideration did take place. Next slide, please. So we looked at how will the essentials add value, and first of all from an organisational perspective. So what will the essentials provide? So for us it would provide an evidence-based content and standards which are up to date and maintained, which links across all health and social care disciplines. It will provide a benchmark for us. It will allow us to cross-reference our staff development, our orientation plans with the essentials to ensure that we're up to date and that we're addressing all aspects. It will provide a framework and structure to complement and to reinforce our current quality management systems and our quality assurance. It will provide a governance framework linked to core standards, best practice standards. It will provide training and support framework for staff, a resource list for learning and development, a development framework for managers, and evidence in relation to regulation, a framework to evidence what we're doing when it comes around to inspection time. From a service delivery perspective, we believe it will improve standards of organisational structure and governance. It will look to improve training and development of workforce, leading to improved standards of care and support, which ultimately is what we're all striving to achieve. It will increase staff satisfaction and overall well-being, hopefully, which will in turn improve standards of service delivery, hopefully decrease staff churn, which we all know is really high within the social care sector, and hopefully improved recruitment due to word of mouth. Improved quality management systems, so therefore an improved yield of data streams to enable us to identify good practice and also service improvement opportunities. Probably more importantly for the supported person, it will provide improved standards and outcomes of care and support, improved overall satisfaction with the service and its team, possibly a greater likelihood to engage with the service more in terms of quality assurance. You're providing feedback for us to review and analyse, and a positive word of mouth review for the service and the wider sector. Next slide, please. So Joe asked me to do a critical friend review, and during my review of the essentials, and I'm not just saying this, I genuinely struggled to be critical. I could only really see how and where it could benefit us as a service. Of course, there were elements that were more applicable to us as a care at home and housing support service, but on the whole, I only really had the one main point to feedback, and possibly being picky, but that was the level of some of the language used and its ease of application directly into our learning and development without any amendment. And that was perhaps me just being a wee bit lazy, but I mean, the materials and basis of this package is aimed at a broad spectrum of health and social care settings. So to get a language or a level of language that meets all needs is nigh and impossible. Having moved from a senior NHS nursing career to the independent social care sector, I can see this from a personal level. There isn't often a one-size-fits-all solution, and possibly that the level of some of the narrative would need to be adjusted to suit our different audiences, and possibly additional structure and explanation may be required, again, depending upon the audience. None of this is insurmountable. I just wanted to try and give a as full and frank feedback as I could. So next steps for us as a service are to go back to the beginning, really, to break down essentials into areas and consider each area against our service. And that will be a step-by-step approach. We'll look to incorporate the essentials into our current structure, which can only have a positive outcome. For me, I really believe it's a fantastic opportunity to improve what we are currently doing and to support our framework for continual improvement. It's an opportunity for critical evaluation of our own systems and processes by having a research-based framework to benchmark against. And we just need the time and space to be able to do this. As previously stated, being in a pandemic really doesn't help. I know from my own services, our teams have never worked as hard before as they have over the last 12 months. You know, folk are tired, but I guess as they say, you know, the show must go on. So to conclude, you know, I hope I've managed to give a brief insight into the relatively short journey we've had as a service to date with the essentials of safe care. As previously stated, there's been a tabletop exercise for us so far, but it's given us a good opportunity to reflect on our current systems and processes, to be able to stand back and cast a friendly, critical eye to see where we can improve. And I firmly believe that the essentials will be an excellent support to achieving this. So thank you for listening to my ramblings for the last 9 minutes, and I'd like to hand over to Sarah Battersby and Kate McConville from Advinia Healthcare.
Hi, thank you, Nick. I'm Sarah Battersby, Head of Quality and Compliance at Advinia Healthcare. Today, myself and Kate McConville will be speaking about how the Essentials of Safe Care framework can be applied in a care home setting. And like Nick, we've very much looked at the resources and tools in the context of COVID-19, but also how we can use them to continuously improve going forward. So as a company, first slide, please. Next slide, please. As a company during the first wave of COVID-19, we reviewed our quality assurance framework and audit schedule to determine what was essential to keep people safe in recognition of the workload required to manage COVID-19 effectively. What we believed at the time was that person-centered care, medication management and clinical risk management had to be the key areas of focus. We were mostly right. What we have learned, however, is that communication and leadership are equally crucial. Without these, all of the above are in jeopardy. The 4 pillars of the framework embody our company learning over the last 12 months: person-centered care, communication, leadership, and clinical and care processes. They're all vital and must all be present to ensure safe care and treatment every time. Shared decision-making is key in the Essentials of Safe Care framework and is, I believe, the next big step in adult social care. It's a natural progression of true person-centered care. Shared decision-making is when medical staff and patients work together to make genuine choices about treatment and medication. So all options are discussed, including the choice to refuse treatment. How often are residents genuinely involved in treatment options, such as the frequency of pressure area care or having positional changes at all? Somebody might value sleep much more than skin integrity at that particular point in their life. It is the ability of the Essentials of Safe Care framework resources to drive improvements in practice, which is particularly exciting. And I do believe shared decision making is one of those key tools, emerging principles that we should see and utilise much more in adult social care. Many of the resources within this framework, including the shared decision making, are medically or acute care based in their language, a bit like Nick was saying. However, the principles are essential in adult social care, also in a care home environment and in home care environments. When discussing this internally, the question arose as to how you can do shared decision making, for example, when a large part of the care home population are living with dementia. People who lack capacity can still be supported through genuine inquiry with those who know and love them, as the options chosen should still be based on their individual context, values and preferences, which is what this is all about. Next slide, please. So safe communication within and between teams. Handover is the vital transfer of professional responsibility and accountability for some or all aspects of care to the next group of those responsible and accountable for that care. The resources in the framework supporting safe and effective handover are strong. We have all seen firsthand where a breakdown in communication at handover has compromised resident safety. In adult social care, we need to do more work around coaching and embedding safe communication processes with all relevant stakeholders, including in the handover process. This applies not only between in-house teams at shift handover, but also handovers with external partners. One of the advantages of the Essentials framework being used across all domains, including acute care, is that resident admissions or movements between different domains within the sector can be safer, with everybody focusing on good communication. This will reduce the risk of residents being discharged from hospital, for example, with limited information about key safety risks. How this can work both ways will be discussed further by my colleague, Kate. Next slide, please. Safe, consistent clinical and care processes across health and social care settings. The real-time staffing risk assessment is one of the tools within the framework that was implemented during the pandemic through the QRAS system and can be used to escalate staffing concerns within a service. We experience using this tool to escalate unsafe staffing levels within one of our homes, where over 50% of our colleagues were off work isolating due to COVID-19. We identified that we had a crisis and did not have the right amount of staff to safely support the residents, and we escalated this through QRAS. Local community healthcare teams were deployed to support to ensure the residents were safely cared for. This experience showed that the real-time staffing risk assessment does work. However, we did experience quite a lot of judgment from the external teams in relation to the outbreak, and we were told that our need for support was an unacceptable use of resource, rather than a supportive focus on dealing with the crisis and keeping people safe, which would have been true collaborative working at every level. So clearly there's still work to be done, but we're getting there in the right direction. For a multidisciplinary system of safe care to truly work, blame cultures need to be left behind, and we need to keep open and supportive dialogue occurring at all times. Thank you. I'll now pass you on to my colleague, Kate.
Thank you, Sarah. Good afternoon, everyone. I'm Kate McConville, a Quality and Compliance Manager for Evinia Healthcare, working within the North region, covering homes in Scotland and the north of England. The Essentials of Safe Care framework has many resources attached to it, which can be used across all sectors. I have focused on the resources which can be easily used within the care home setting. The Knowledge Network is one of the resources which was developed by NHS Scotland. The tool is beneficial and can be used to coach colleagues on effective communication. Within care homes, often when something doesn't go to plan or goes wrong, it can be usually linked to a breakdown in communication. We have used this resource to coach colleagues from a particular unit where there were concerns over the way colleagues were communicating with residents. The resource covers practical steps, communication techniques, adjustments to communication, depending on residents' needs, and has video links. When completing this session, we used role play to demonstrate the different communication techniques. Feedback from colleagues was that it was useful, and the unit manager noted there was an improvement in communication between her team and residents. Another resource within the framework is the SBAR tool. The SBAR tool has been widely used by healthcare teams as a focused way of transferring information about a person's condition. We implemented this tool in one of our intermediate care units as there was a breakdown in communication between the care home colleagues and healthcare professionals. It was noted that implementing the tool improved the effectiveness of communication through the standardisation of the communication process, and health professionals also noted the improvement. Using these resources has improved communication between colleagues, residents and the multidisciplinary team, which promotes better outcomes for the residents. Next slide, please. We all recognise that colleagues are burnt out and tired. In order to retain colleagues going forward, a focus on wellbeing is essential. At the beginning of the pandemic, COVID-19 had a devastating effect on one of our homes. Over 50% of the residents sadly passed away. Colleagues within the unit required emotional support as they had mixed emotions and were having trouble expressing and processing this. We arranged sessions with the local hospice where colleagues were able to receive virtual counselling sessions. The engagement from colleagues with this was good, and it helped them process their thoughts and continue to safely support others. The Essentials of Safe Care framework includes links to a resource made available by the SSSC on coaching for wellbeing. The benefit of this resource is that it can be accessed by anyone and is not dependent on the manager arranging the sessions. It enables colleagues to draw on and make the most of their own strengths and experience. It is a safe space to reflect on what is going on and supports to make positive changes. Next slide, please. The framework also has links to resources about person-centred care and systems being embedded into practice within the care home. Two of the resources are the Social Care Institute for Excellence and the What Matters to You movement. Although I've not used these resources, I can see the value of using them in the care home sector and plan to arrange coaching sessions with colleagues in relation to this. From reading Care Inspectorate reports from various providers across the sector, it is evident that person-centred care is an area which requires to be embedded and developed further. In summary, all the resources are in one place, making them easily accessible, and each resource will help to improve the safe delivery and quality of care received by residents, which is adding value to the service. Thank you, and I'll hand you over to Aidan McGrory.
Thank you very much, Kate. So we're going to take a pause just now and review some of the questions that have come in on the chat function, but I just want to say a big thanks to Joe, Nick, Sarah and Kate for your contributions so far. Really insightful stuff, particularly around the adaptation of the essentials into your particular contexts. And it really brings to life some of the elements of this that can really be rapidly implemented and show some positive outcomes. Hopefully that's been beneficial for the audience as well. So there's a couple of questions that that have came in, and I'll go to the first one, and it's about how the essentials of safe care have been developed and who was involved. I do recognise that there was a slide on that throughout the presentation from you, Joe. I'm not sure if you just want to elaborate on that slightly about how the collaboration bit and the number of agencies involved.
Yes, so as per my slide earlier, and as I was describing, it really was a whole system piece of work, and as we started to identify what the priorities were within the essentials, it was about how did we make sure that we were reflecting the different contexts from health and social care, also the third and independent sector and housing sector as well, and using some of the key national organisations to enable us to tap into a number of different respective services on their own. So we were helpfully signpost to services who may be able to support us in that. So we really had representation both from right across the system, but also right across the different levels of different professional groups, managers, leaders, through to actually people delivering services and care. So it was a really broad perspective that we brought to those design groups. Thanks,
Joe. Yeah, having been involved in that early piece of work with you, I was struck by the breadth of engagement and the number of different like I say, agencies, organisations, provider groups that were involved in that conversation, and the value of those conversations that everybody contributed to really shaped how these essentials are formed and contributed to the finished product today. So thanks very much for that, Joe. There's a question here around how closely aligned are the essentials of care and the health and social care standards, which are applicable to all. That's quite a good question, actually. That might be for you again, Joe, actually, unfortunately, if that's okay.
No, it's absolutely fine, but I wondered if my colleagues Nick and Sarah and Kate, also from their experience of thinking about it within their own settings. I mean, within the design groups, it was one of the principles about ensuring that we weren't doing anything new. It was about bringing together what was already the asks of the different settings, the different standards and guidance, and ensuring that we were embedding that within the content of what we were developing. I think it's fair to say that this is going to be an iterative process. We don't expect that we have cracked it first time around, and we do feel that through the feedback that we get from people looking at it, using it, that we'll be able to identify where some of those gaps are, but also where some of the evidence is really strong. So we think really this is something that's going to continue to evolve, and we need your feedback to help us do that. But I don't know whether others may want to reflect from actually at a service level how this supports them in those health and social care standards.
Thanks, Joe. Yeah, I will open that up to some of our colleagues, Nick, Sarah and Kate, if they have any reflections on that.
I think having all the resources in one place is incredibly helpful, and they are relevant resources in order to maintain the standards that are expected of us.
Thanks, Sarah. Yeah, totally agree. I mean, having seen this package being developed, there's been a lot of work into that interpretation element of them, and that testing phase that you and other colleagues participated in really help with that critical feedback in order to kind of make it as applicable across health and social care as possible. So thanks for that input. Any reflections from, not to put you on the spot, and absolutely don't come in if there is nothing you want to add from Nick and Kate. We do have some more questions to come to as well, so absolutely not putting you on the spot there.
Yeah, no. I think for me, Aidan, really just to echo what Sarah's saying, the fact that a lot of these resources, particularly the resources that are linked to the framework, they're not new, they've been available for a while, but it's just about knowing where to go to be able to access them. So it's really useful, the fact that they are all in the one place, and there's a lot of the resources that some of the care homes probably don't know about, but they have been there to help them. So the fact they are all in the one place, they can use them whenever they feel the need to, certainly is a benefit.
I'd just add, I think they're completely aligned with the standards, and I'm probably going to repeat what's already been said, but what we spend a lot of our time doing is making sure that our resources are up to date. What the Essentials is going to offer is almost a one-stop shop, which is maintained. So you know that when you go there, you're going to be accessing the latest piece of research, the latest document. So in terms of alignment, as I say, yeah, completely aligned with the standards. It's not, I don't mean this disrespectfully, it's not offering anything that's not already out there. It's just pulling everything together in a fantastic resource which is easy to use.
Thanks, Nick. Yeah, that's coming through strongly from all the speakers today in answering these questions. That before you said, I think it was you, Nick, they said the one-stop shop. That was what was ringing in my head. You know, as to set an easy context around it, that's what it feels like, as a one-stop shop for multiple resources to support in multiple different ways. And I think that will add benefit for people. couple more questions are coming through. I'm just going to group two of them together, which kind of are asking about, do we need to use this whole thing, or can we cherry pick elements out of the essentials package that is relevant for us? So open that up to whoever wants to comment on that.
I wonder if I could start, Aidan. I saw that coming in and absolutely can understand where people are coming from here. And the short answer is yes, you can. There's absolutely no issue with that. What I would suggest though is considering each of them within that broader context, because as we started to develop the package, there is much interface between each of the 4 core essentials. So communication, whilst it's called out as an absolute essential, it runs through every element of the overall package. So that there is something there about you can absolutely focus on an area that you've identified as an area for improvement, but consider it within that wider context of the overall package of the essentials, because there may be other elements that will help you achieve the improvement that you are wanting to make.
Thank you, Jo. We've time for a couple more questions. There's a question here and I'm not quite sure about it, so I'll pose it and we'll see what people think. The question is, not having seen the resources, is there a similar resource to Progress for Providers, which you can record where you are as a service and develop action plans geared towards improvement? I'm not familiar with the resource called Progress for Providers. So I guess this question might be around, is there something in the package where you can record as a service your progress within that element that you're working on, and develop action plans within that?
Yeah, it's Jo again. So in a nutshell, yes, there will be, and we're doing that in 2 ways. The first part of that, and we're calling this the measurement framework. So the first part of that is that organisational readiness assessment for change, which will pose some questions about your organisation, about the teams, before then exploring how you're doing against each of the essentials. And from that assessment, you'll then be able to understand where your areas for improvement are. And the second part of the measurement framework is then helping you in measuring the improvement that you are making. So we're in the process of finalising the readiness assessment first, because we felt that that was really key, as many of you will know, to making any change. You need to really understand your system, and is your team and is your organisation ready to make that change? So we felt that that was the priority piece to get out, and very shortly after that you're then going to get the measurement framework for the actual essentials. As I said in my slides, it's not going to be mandatory that you need to be submitting your data for anybody to be reviewing. This is for you to use for your local context, but as part of that overall learning system, we are really keen for people to share what they're doing, how they're doing, and what they're learning from it, and the measurement will be a key part of that.
Great, Jo, thank you. And it's you know, the message is coming through that, you know, this package has just been launched last week, and there's various more information to still come around that, like you've mentioned there, around the measurement plan and a temperature check tool for services to understand their readiness for improvement and things as well. So we're going to hear a little bit more about that from speakers later about implementation of some of this stuff. So hopefully that'll maybe answer some of those questions that maybe people are holding back just now. There is one more question that I'm just going to hold off until the leader from Leanne to the leader Q&A session, but it won't be lost, around environmental changes in the input from public health. But right now we're just going to take, as per our schedule, a 5-minute break and just come back at 25 past 2, and then we'll get into the rest of the slides and content, and then we'll have some more Q&A at that point. So go grab a cup of coffee or tea, and we'll see you back at 25 past. Thank you. So, hi folks, just like to welcome you all back. Hopefully you had a nice 5-minute break there, whatever you can achieve in 5 minutes. I'd like to welcome Jo Matthews back on to the call, and she's going to talk you through a slide set around joining the dots. Thanks, Jo.
Thanks. Next slide, please. So welcome back, everybody. So in order to create the conditions in which care can be safely delivered, understanding how your current service is doing is the first step on the improvement journey. Being able to connect the multiple elements of information into meaningful intelligence that can help you identify and prioritise where your focus needs to be will be really important to support not only your medium to long-term planning, but also identifying what are those things that actually you've got an urgent priority to do. As part of the work to develop the essentials of safe care, we embedded the Care Home Huddle tool within the resources and see this as a really key part of joining the dots around that intelligence. So I'm now going to hand over to Nancy Burns, who has been pivotal in the development of the Care Home Huddle tool, and she's going to talk you through the connections to safety and the overall tool. So over to Nancy.
Thanks, Jo. So as Jo said, my name's Nancy Burns. I've probably met quite a few people on the call already. I'm a senior nurse, work within HIS and in the health and care staffing programme. But during the pandemic in April, I was moved over to Scottish Government and I've been working with the Safety Huddle and the care home sector since that time. So thank you very much. I'm just going to progress with my presentation now. Thank you. Next slide, please. So again, thank you very much for inviting me today. The work that I'm going to do show you today supports the conversation around a few questions about how are we doing, how do you know how you're doing, and what are you going to do now, and about how data can make you really curious. So today I didn't really plan to do an education session, more around what the data can do for you and stimulate that conversation. Can you do the next slide? And the next one again, sorry, that one's rogue. There's always one, isn't there? So anyway, thank you. I'd like to take the opportunity to say a huge thank you to the care home sector. You've been so instrumental in the development of the Safety Huddle tool and also your continued support, because we know this has been really difficult during these unprecedented and exceptionally challenging times. What we did, we really listened to what you had to say, and what you said is you didn't really benefit from the data that you gave out to a variety of people. And the promise we made is that you would have your own dashboard, and that's for your own individual care home, and that would provide real-time data, and that would support you at the start of your quality improvement journey. So future developments, I guess what we say is we were building the plane while flying it. It was such a journey to take us from an Excel template in April down to digital in August. So NES Digital work in an agile methodology. We start off iterative process and then build on it, and it's built on user feedback. So that's why your feedback is so critical and so important to us. The next stage will be make those improvements to the data quality, trying to align your understanding, and then work on outbreak management. Staffing definitely needs to be updated to get good quality data. Looking at how we can get quality measures added in and the IPC improvements there. But what we're really clear is no more duplication of effort, and there'll be no additional data burden, and I think that's really important. So wherever possible, we're looking at doing data feeds, and a good example of that is the latest LFT one. So hopefully you'll all be in approval of that. So next slide. This is just really practical. So when you go into your Safety Huddle, the little pink arrow there, if you press up there to reports, you will get access to all your dashboards. So you've got your COVID vaccination dashboard, you've got care home dashboard, staff screening, etc., all there for you. Do you want to just go to the next slide, please? Thank you. So the first page in this new care home dashboard is really a situation awareness page. So what it does is gives you that data at a glance. So the data is pulled through from all the information you put into your Safety Huddle every day. But it gives you also an opportunity to kind of data quality check the information that's been submitted. So an example would be checking if your outbreak status is correct and all the escalations you've entered feel right and feel correct. The next line is all your COVID activity, helps you track that. And also down the bottom in the left-hand corner, you'll see staffing levels. So we know that this is a real area of improvement. So what we notice is that on there, you've got, you need 40 staff. That's the staff that are available on duty over that 24-hour period. That would include your actual and your supplementary extra hour staff. So total number of staff on duty to be able to deliver care. But what the care home sector is saying in the professional judgment is they're needing less. And we need to understand that a bit more moving forward. But I can discuss that more in the staffing page. Over to the right, you've got your care home baseline figures, your occupancy, really important to track that, as you know, based on sustainability model, and also your monthly figures helping you track the number of transfers and the number of deaths on that month. Okay, next slide. So this page helps you to review your escalations. So this at the top, you'll see an outbreak status bar. So obviously we don't really want people to have an outbreak, but if they do, it really helps you track and helps you tell the story. And it helps you, there's some advantages to that. So provides you with a real clear record of your actions, how you've mitigated, how you've escalated, and generally how you've managed the situation over time, and building up a picture of that dependency and complexity. So this is your data. So this is about you. You've got the local knowledge, the local understanding. It's about annotating that and telling your story. And then just be curious, are there recurring themes that are happening, increasing dependency, complexity, frequency in terms of escalating for staffing? And let's say, just be curious. Next slide. Thanks. So data is really useful for many reasons. I don't want to suck eggs here, but you know, that assurance, scrutiny, really important to celebrate successes as well, audit purposes, and of course to help you focus on some quality improvement opportunities. And then when you start to review the data, again, it's that starting to tell the story, how we're doing, how do we know, and what we're going to do now. And data is really powerful. Understanding that data will tell you that journey. And I guess if I just focus on transfers, so we know that there's, from the data that you guys are submitting, there's about 7,000 transfers in the last 6 months. So we don't know if that's higher than normal. I suspect it probably will be because we've not had previous data, but it's really powerful. And I guess being curious, I'm quite curious individual, but it would be that my questions would be things like, is that an unusually high number of transfers? What's it telling me are the trends at the weekends or the out of hour period, and why is that? Could any of them have been preventable? And maybe if you review the ACP or KISS summaries, were they out of date? Did that impact on the transfer? And I guess what were the staffing levels, the skill mix, and did that impact? It's just about being curious. But also what we're finding is when I am doing reviews of care homes during the IMTs, what I am finding, and it's just that telling the story, is that the care homes that have had an outbreak, what you're finding, and you see I've circled the bit on the non-COVID and COVID transfers to hospital, the blue ones, the blue spikes are the non-COVID, is that generally we're getting a spike of transfers prior to outbreak. Now that could be for many reasons, the softer signs of COVID. It could also be the care homes starting to come under stress and distress, and that could be that a lot of the staff are self-isolating, etc. You've got real challenges with staffing. But or the complexity is so great that staff are really struggling and unable to cope, and therefore the best thing they can do is to send their resident to hospital. So that's next slide, please. This page helps you monitor and track the dependencies. We're really aware that this page needs to be updated. I think there's been we listen to feedback. So what they're saying is the one-to-one is not necessarily something that they're recognising, and it's not well utilised. the number of residents living with cognitive impairment, that's a useful figure to get your percentage, but it doesn't necessarily align with one-to-one. And also the end of life care, what you start seeing is that monitoring the increase in dependency and what additional support, etc., that the care home needs, but also how that doesn't really align to the number of deaths either. So some of the care home staff have said to us, we really feel there should be something different there. Yes, end of life care, but perhaps palliative care in there, because that would actually help capture better those kind of varying levels of dependency. So I guess we don't do anything without stakeholder engagement. So you know, you have a chance to feed into that. There's a feedback button on the system. Send in your feedback, and that's really useful for the system to get better, because that's how NES Digital work. They work in that agile methodology and based on feedback. So that would be really good for you to do that. And the next page. Next slide, sorry. Okay, this has been the most contentious part of the whole safety huddle. It was, as I say, it was built at speed. We listened to what users said. They wanted to just do their staffing in a 24-hour period. We introduced this page so that it kind of aligned to the Health and Care Staffing Act. So this would meet the real time, or partly meet the real times. We need some adjustments on that, real time staffing. And for those that don't know, the Health and Care Staffing Act, the key principles, it was passed in 2019, and the key principles are the right staff at the right place at the right time with the right skill. All about improving outcomes for your residents, but also for the staff experience as well. And under the real time, it's a duty to ensure appropriate staffing and a staffing assessment in place. And actually, you've got a risk escalation. So in the safety huddle, you've got the risk escalation. You can either mitigate the risk, no risk, or escalate the risk. And what this slide tells you is the number of occasions when you've had to escalate and how that aligns to your available staffing. So yes, moving forward, we want to do some more discovery work on this, and you'll be really key in shaping this. But actually, going back to this data, what's it telling me? So when you review your actual staffing levels, and that would be the number of staff that are on that shift in that 24-hour period, that's available, including supplementary. And you base that against your professional judgment line, the pink one, you see a huge gap. You shouldn't necessarily see that. So what we're saying is that you've got 43 on shift, but you're actually saying you're only needing 36. So we've been kind of fed back a little bit on what the case may be in that, and it could be that you're using just direct care staff rather than your total staff, including your ancillary, because you need a cook and a chef and a domestic to be able to deliver safe and effective care. Some people say actually it's more than my job's worth to put what I really truly need on duty, and other people have said, well, I go by what I could never go below, because that would then be unsafe. But the principle of the safety huddle tool and the script that we have there is that how many staff do you need on duty to be able to deliver all care? And that's your professional opinion. So further work needed to understand what the barriers are and what we can do to make it better. So you can see on the left-hand column, it will give you the number of occasions escalated, and that'll be really important when it comes to the Health and Care Staffing Act and how we can triangulate this data with some quality work as well. Next slide, please. So just some points for discussion, and its data is really powerful. Data supports the 3 key questions that you're wanting to ask yourself in that curiosity journey. It's really important that you kind of use this to empower and engage the team, and use data to start your improvement journey. Support in that escalation of change, and support the Health and Care Staffing Act in 2019, opportunity to have that real-time staffing aspect of the Act, providing evidence. And I guess celebrate success, because there's not been a huge amount to celebrate this year, has there? So if there's some good stuff that you're seeing coming out of it, and I'm hearing lots of really good stuff, celebrate it with your team. And thank you very much. Back to yourself, Joe.
Thank you very much, Nancy. Really important information there. And as we move to the next section now, it's really starting to bring all of that together. So we've talked about the package, we've talked about the network, the measurement, the data, and how do we bring that together into one system where people can learn and share from. So I'm delighted to now hand over to my colleague Jill Gillies, who's going to share with you the Essentials of Safe Care learning system.
Okay, thank you, Jill. As Jill said, I'm Jill Gillies. I'm the Improvement Advisor for the Primary, I'm Portfolio Lead for the Primary Care Improvement Portfolio. And I'm just wondering, could you move to the next slide, please? Thank you. So I am going to spend a little bit of time just now talking about our Essentials of Safe Care learning system. I'm going to start by describing what we mean by a learning system. And a learning system enables a group of people to come together to share and learn about a particular topic. So a little bit like us this afternoon on this webinar. A learning system helps us to build our knowledge, share our successes and overcome some of our challenges, and ultimately accelerate our improvements. The learning system enables us to share and has a number of components that support the sharing of that learning. And you can see on the slide there with a number of boxes that outline the different components within a learning system. And I'm going to spend a few minutes describing these, but we're also really keen to hear from you today. And as we begin to support the implementation of the Essentials of Safe Care, what would be useful to support you as you begin to consider implementing these within your context. So no surprises in this virtual world, webinars are a key component within our learning system, and we'll host a range of webinars. We've started today as we begin to explain the overall package and that the Essentials of Safe Care comprise of, and we'll host another one in a couple of weeks. We'll attend another one that Scottish Care are hosting, and we'll again outline that overall package. And then we'll look at sort of the different specific elements within the Essentials of Safe Care, and we'll look to deliver content-specific webinars. And one of the first ones that we'll aim to focus on will be the measurement framework. We've talked a wee bit already today around about measurement, and we'd look to, on that webinar, explore the readiness assessment tool and how you would consider applying that to your overall context, but also then thinking about, having completed the assessment tool, how you'll use the actual framework and the measurement framework for the essentials to think about how you can apply that within your context. And I think somebody asked earlier around sort of tracking progress and if there'll be tools and ways of doing that, and absolutely the measurement framework, as Joe has said, is not mandatory in any way, but what we look to do is provide a range of tools and mechanisms that will allow you to capture and track your improvements as you're beginning to implement those. So I think it was a really nice slide from Nancy Tendon in and around that data, and data is absolutely key in and around the essentials of safe care. So we'll also look to host a range of webinars based on the drivers within the specific essentials of safe care. But we'd also be keen to host webinars based on topics and areas identified by you. So please do keep us informed of what would be useful to support you as you begin to implement this. Our learning system will also host a range of networks and special interest groups to come together and share experiences. And we'll work with all of our stakeholders to build the Essentials of Safe Care network. And again, we'd be keen to do that with all of you. And within our learning system, we want to provide a range of ways in which you can share the learning to support the implementation of the essentials. And we recognise that not everybody can access webinars or join networks. And so we'll look to capture improvements through capturing case studies, sharing your stories through blogs and through insights. And so our go-to place, or as Aidan said earlier, our one-stop shop for accessing everything is on our website. And the next slide, please, has all of the links to the tools and the resources. And I know it's not ideal seeing these links on a website, so we will share this with you in the sort of information that comes out following these webinars. So thank you, and I'll now hand over to Craig Morris from the Care Inspectorate.
Thank you very much. Can I have the next slide, please? Good afternoon, colleagues. My name's Craig Morris. I'm Head of Improvement Support at the Care Inspectorate. It's really my job to bring today to a summary. We've heard a lot. There's been a lot of information. Don't worry, I've only got one slide and I've only got a couple of key messages to finish us off today. The first thing I want to say is I recognise the last 12 months and how hard we have all worked. And I think the statement earlier on today really summarises it for me. We've never worked as hard. And again, you know, as Head of Improvement Support and from everybody that's on the call today, we really appreciate the work that's went into the last year, you know, in terms of where we're at just now. So that would be my first message and the most important message that I want to say as an individual. When we talk about collaboration, I often hear people are a way to collaborate, you know, they're a way to work together. But for me, what today is really shown is 4 agencies, whether it's national bodies or the care sector collectively, have come together today to deliver this. And that for me is the real art of collaboration, when we're all working together and we bring it back to the people on the picture here. It's about their outcomes, it's about their care. And one of the things I want to build on is really, we've heard for many years now, getting it right for every child. But for me, that should be from birth to end of life, that we're getting it right for every person, every time in their homes. And what the Essentials of Safe Care package allows us to do is it allows us to do that. It's one tool to really help us to deliver safe care in people's homes, because that's what it's about. So again, thank you very much for this afternoon. Thank you to everybody that's put the effort into today to make today happen. Thank you to yourselves for working through today, and there'll be a lot of learning as we go forward. I know that it will not just be an hour of your time, that there'll be other learning that you want to take on board from this. So it leaves me no further to do to hand back to Aidan to finish us off for the next section. Thank you very much, everyone.
Thank you, Craig, and thank you also to Jill and Nancy and Joe for their contributions in the last segment there. So I'm going to take you through quite briefly the remainder of the questions that have came through in the Q&A function, and I see that Nancy and others have been in kind of answering some of those in that function. Just to reassure folks that we'll send out all the slides from today that have all the links to the various resources. We'll also send out all the questions from the Q&A function with answers to them as well, with the slides and a link to the video of today as well, so people can cascade that learning and use that to reflect on at their own pace. Just to come back to a question that we had earlier on from Leanne, which was around the learning from environmental changes and settings and the input from public health, is that covered within the essentials? I'm not going to generalize around that from my point of view. I'm going to hand it over to Joe, I think, but I'm not sure that the essentials are that specific, Leanne. I think it's more a framework for learning, but I'll pass it over to Joe and open that up for comments.
Yeah, and thank you, Len, for that question. In particular, the clinical and care processes essential driver had representation from Public Health Scotland within it, and some of the advice that we were getting there was around really using the National Infection Prevention and Control Manual as the key resource, of which then the information within each of the respective sections of that being able to provide the support. But again, this is the sort of feedback we need to be able to understand. Have we got the right level of information in there, so that we continually keep revising that, so we can go back and have a look and understand it. You know, is that something that we need in addition, or is the signposting at the general level the best place to keep that information at?
Thank you, Joe. Hopefully that's been helpful for Leanne and others. a couple of questions here. It looks like it's for Nancy, and I recognise, Nancy, that you are on the chat function and answering some of those, but I'll maybe just call out some of the things that you have answered already, so bear with me on that one. But one question there is around the Huddle tool. Are other types of outbreaks, such as the flu and norovirus, are they going to be incorporated into that going forward?
Yeah, there's definitely an appetite for that from the care home sector. So such as norovirus, seasonal flu. Again, we're setting up discovery groups to explore how we capture that. But what we're really keen is we don't cause some data burden and also, you know, overwhelm the care home sector. So it's a bit of a balance there, but wherever possible, we're trying to do data feeds in, like you'll see in the LFTs just now. It's like you put the data in once and then it churns into a dashboard for you. So yes, thanks.
Thanks, Nancy. And then again, a topic that's coming up from a couple of people around the Huddle tool for the care home sector. What's the view for the way forward on that?
So there's certainly people in Scottish Government and HIS, actually I know HIS has been doing some work with Care at Home and looking at it. At the moment they don't think the Huddle is the right way to go, but they are looking and exploring ways to capture data from Care at Home because it's been very valuable from the care home service. So watch this space.
Yeah, absolutely. That's the danger of something that's quite successful. Everybody wants to get in on it slightly and adapt it to suit different needs, and like you said, is that balance, isn't it, of the burden versus the benefits, but clearly benefits there from the Safety Huddle tool and the success that has had up until this point. And again, another question around the exporting of data into reports. Is there a plan for that? So I'm assuming that's around, you know, we're going to get some sort of national reporting structure from this on at a frequency. I'll make that assumption.
So I'm struggling to kind of work that out. Within the dashboard, there is an ability. There's reports that are all there, and you can print off your own reports using a data export. But what NES Digital are really keen on it is if you find that there's something in the new care home dashboard that doesn't meet your needs, or the KPI dashboard, and you think that it could be presented in a different way, just give them feedback, because that's how they'll develop and shape the dashboard for you. So if you're finding you're having to download something and it could be better seen in a dashboard, just let them know through the feedback reporting system.
Great stuff. Thanks, Nancy. I think there's a question here. It's for Jill, and I think this question kind of came in as Jill was speaking about what the intention is for the implementation of the package, but it's around, will there be follow-up webinars on the essentials of safe care? And Jill did talk about that, but I'll bring it again, Jill, just to elaborate on what that plan is.
Absolutely, Aidan. We're really keen to have specific follow-up webinars, both on the overall measurement framework. We think the first sort of point of taking this, and then we'll look to have specific webinars on each of the drivers, and from there we're really receptive to hearing from people if they want specific webinars, and we'd be keen to, as people are beginning to implement this, that we actually are able to share the learning. So really important that people should be able to, through webinars and seminars, share their data, some of the challenges that they've had and how they've then potentially overcome that. So absolutely, we would look to host those webinars on an ongoing basis, and also the networks that I talked about. So how do we support those networks and special interest groups in coming together and sharing that learning? So absolutely keen to continue to do that.
Thanks, Jill. Yeah, that real community of practice really resonates with people coming together and sharing their experiences. And again, I suppose it's to reiterate that this is the start of this process where we're introducing what this package is, and the support mechanisms around that will develop as it runs its course over the next months and years potentially. So look forward to being involved in those communities and networks, as I'm sure colleagues will as well. And one final question I think we'll have is, looks like this one's for me actually. When will the Kerr inspector start using this data rather than duplicating data entry? I believe that's a reference to the safety huddle tool. So from the conversations that I've been involved in, Alison, that's a very hot topic just now about duplication and data burden, and how do we integrate the key KPIs or notifiable information that's coming through in the huddle tool and reconcile that with our notification process without having a great deal of detail about the next steps around that. It's certainly a standard agenda item in a number of strategic conversations in the Kerr inspectorate, so hopefully that will be bottomed out sooner rather than later, but it has been recognised within the Kerr inspectorate that that's something that we need to give some attention to, so thanks for that question. So we have 5 minutes to go, and I'm just going to take that time to, next slide please, to come back to, to make you aware of some evaluation questions that we're going to ask in relation to the webinar today, and how that obviously relates to the essentials of safe Kerr. So we've put those questions just on the screen for your ease just now, but we're going to put a link in the chat box just now and send that Stephen's already done it. Thank you, Stephen. And if you click that link, it's 5 easy questions, and just let us know how this webinar went, because this will absolutely inform how we deliver these going forward, and it will take you 2 minutes to complete. We'll also send that evaluation out with the slides and things as well if you don't have time to do that today, so please do that. And just to start the round up, to thank everybody again for their participation today. We hope that you found this informative as a very first step around engaging with the essentials of Kerr, and we've really brought to life how some of the elements of that can add value to your current practice. So that's our hope, and we believe we've achieved our objectives in terms of bringing that to you. And also just to say thank you very much to Healthcare Improvement Scotland and other colleagues for the content that they've contributed today, and everybody else who's been involved in the delivery and planning of the webinar. Just to hand back to Joe Matthews for a final word, and we'll let you on your way to enjoy St. Patrick's Day.
Thank you, Aidan, and I think it's really just to reinforce the messages that you've just given. We know we're at the start of this journey. We know we haven't got it perfect from the outset. This is about you telling us what you need and how we actually try to adapt the tool to support you in delivering and achieving that aim of safe care for every person, every time, and within every setting. There is much learning from what we've done over the last 9 months or so, but we know that there will be much more to come as you really start to consider this within your own settings. So please do let us know. Join the network, become part of that learning system, and through that we really are going to build a package of support that is going to achieve that aim. So lastly, I'd like to thank everybody who has supported us in the delivery of this session today. And also thank you for coming along. I appreciate how busy your time is just now, so to take 90 minutes out of that, we really do appreciate that. Hope you found it helpful. Please do complete the evaluation. We're running a number of these sessions, and as I've said, it is all about the learning, so your feedback will help us improve for the next one. So thank you very much again.